My name is Pascal Zigeshane. I am a refugee and I stay in Kakuma too, which is part of the camp. And I'm currently studying at Southern New Hampshire University, where I'm doing my bachelor's degree in healthcare management, measuring on global perspective. After being in the program for 2 years, I learned a lot. I've taken several courses, and part of it has enabled me to look at the problems that are in the community. And one of them is the current health situation in the camp. We have problems with diseases in the camp, like malaria and outbreaks that people can actually prevent if they are told to and if they are trained to do so. Looking at all of that, I came up with an idea to establish a community-based organization, and our mission was to bring an activity called community health and physiotherapy. And with this, we have some few courses that we bring to the community, and then we teach them on how they can handle health community within their own communities. We have more than 60 students, and many of them, like we've had 3 of them who are currently employed. After doing the course, they went and they got a job in these organizations that are providing healthcare to refugees in the camp. We've had a quite good number of refugees from Sudan who are taking the course, and some who went back to their country. They're also communicating with us that the course has helped them also go to another level of education in their country in that field of healthcare. And when you look at some of the courses I did at Southern New Hampshire University, it is really helping in this particular project. We also have other activities that we are running within the organization. We are also looking at the fact of caring for the older people. They are given the same thing that people of my age are given, yet they have special need. There is a gap to care for these older people. And currently I'm developing a proposal that we are sending to the government of Canada with a partner in Canada so that we can get the grant and see what we can do for our elderly people. I look at the future to be bright because I believe that the journey has started, and I look forward to succeed in running this organization, to make it big so that it can be expanded to other countries.